Okay, cool. Thanks for joining us at Town of St. Paul for this council meeting, August 12th, 7 o'clock. If we could please have a call to order and roll call at this time.
Mr. Simmons.
Here.
Mr. Trevino.
Here.
Mr. Graham.
Here.
Mr. Swanner.
Here.
Mr. Dryden.
Here.
Mr. Nail.
Here. We have a quorum. So please stand for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, gentlemen. And woman. Sorry. So at this time, I don't have any public comments in front of me. Were there any public comments that were turned in? People wishing to speak?
No.
Okay, at this time, we'll terminate the public comments since we don't have anyone. Going to agenda item 4, consent agenda. It's for the approval of the minutes from August 8th. So does anybody have any discussion questions? None here? Open, close, it's that first tab. New tab. If there's no discussion points at this time, do I have a motion to accept the minutes?
Yeah, I move to approve the minutes from July 8th, 2024.
Okay, do we have a second?
August 8th?
August 8th.
Oh, I was reading the motion. Okay, August 8th.
Well, we're on 4.1. Just make sure you...
Again, you make the motion to accept?
Yeah, I accept the minutes from August 8th,
Okay.
2024.
I second that motion.
Okay, all in favor?
Aye.
Motion passes. So moving on to agenda item number 5, the regular agenda items. Discussion and possible action on the interlocal cooperation agreement with the City of Wiley for EMS transport services. Discussion points about this. You can see the interlocal agreement in front of you. You all got it in your packet. If there's any question while he's here.
Oh, hey, Mayor, before we continue,
Okay.
I'm just looking for clarification on 4.1, Mr. Albert.
4.1, okay?
So it says information this evening, the council will consider approving the meeting minutes from July 8th. But over here on 4.1, on today's agenda, it says approval of meeting minutes for August 8th.
It should be August 8th.
Okay,
That's correct.
Sorry about that.
cool, thank you.
Okay. Thanks for bringing it up.
Yeah, I think in general, just to hear from Wiley around why the increase, I think that was already mentioned before. There was a presentation given, but just some discussion on that would be good. If you have some
Sure.
details around what's going on with that.
You came and gave her a presentation a while back. Is anything updated or changed since you came in to make that presentation?
I mean, nothing operationally. We've kind of got the budget finalized now. The ILA is kind of the last thing. I think the town of St. Paul has already reduced or sent a letter getting themselves out of the coalition. So all those things that we talked about that needed to happen, I think have happened. We've nailed the budget down now. Operationally, probably the biggest thing that we've changed is there's not going to be this big, they pull their ambulances out and we pull ours in. We're already running all of the ambulance minus 1/3 of one ambulance, so they have one shift at Station 4 on A shift. Other than that, it's all our personnel. And obviously, as the deadline is near, they've gotten, their employees have found other jobs, the ones we weren't hiring. And so I think you've probably already seen a higher level of service than you were getting before. Hopefully none of y'all or none of the audience have had to use it. But if you called an ambulance, I think you've probably already seen that increased level of service. So other than that, those are the big updates. ILAs, tomorrow night, 2 of them, other cities that will provide EMS for, which will lock in all these prices, go to council, to our council. Y'all's and Collin County's will go at the next meeting, so the 4th meeting in August, or 4th Tuesday in August. And after that, we'll be just waiting on the deadline for October 1st. And we have that presentation. I know there's some new council members and new city manager. If anybody needs us to go over any of that thing or review any of those things, if anything stuck out for those of y'all that work here, we'd be glad to put it up and go through it real quick.
So I see how we're calculating, which makes sense. You take the total number of calls and you take the calls that were within our town, and then you use that to create a percentage. Is that done quarterly or annually, or how is it done monthly?
Oh, it's done year to year. The payments will be,
Quarters.
So it'll be, so that's 23's total call line, January to January. The next time you get a bill, it'll be 24's calls. So it's actually a year in the rear is what you're paying.
Okay, so you take the percentage based on the previous year, and then you pay that quarterly? Okay. All right.
Who polices the calls, whether it's in our town or ETJ or Inspiration, or how do we know?
we send in, well, we have our computer-aided dispatch system set up so the Inspiration's separate from St. Paul. Now, doesn't mean somebody doesn't call on a cell phone and say they're at town hall and they're across the street. In the past, the city administrators have done that. When Mr. London was here, he was very hardcore on us about, hey, this happened. The front part of this address is St. Paul, but the back's the county, and that's where the grass fire was. So we're not paying that. He stayed on it.
If there's any, the policy internally, if there's any dispute, it's not.
Okay, that's something.
We'll follow up.
Yeah.
Yeah, we
in
invoice.
charge of.
Leanne was doing it, and now I'm sure that.
We'll do it.
Yeah. So, yeah, and it's not a lot. I mean, we don't run a lot of calls out here. Y'all are about, for EMS, y'all are about 1.75% of the total call volume. So it's not like it's real strenuous on one person to go through it every month. We'll provide them on a spreadsheet.
Even with Inspiration, it's not that much more.
Y'all don't carry, we carry Inspiration's number. We have a contract separate from this ILA with Inspiration.
All right, so we don't see their activity.
Y'all don't see their activity. We carry their population in our population numbers
Gotcha, okay.
for this.
Even those St. Paul addresses for Inspiration, correct? They're
Yep.
pulled out.
If they're in Inspiration, we have those boxes, we have an IN in front of them, and so our CAD system, when we run reports, it separates that out.
And so part of what you've changed is you're no longer doing non-emergency transfers, is that what we're doing?
Which should gain us about two calls back per day, because we're averaging just almost 600 a year. So we should have about 2 less calls per day, which obviously make our ambulances more available. We will continue to do emergency transfers. We treat those just like a 911 call, and we have a registration system for private ambulance services that they have to follow. That's in our new ordinance. So they have to register with the city. We've already had 2 ambulance companies register. So I anticipate that they will start taking over those non-emergency transfers.
That's mainly from health facility to another health facility, right? Or?
Yeah, so the big place that in Wiley, it's either long-term care facilities to hospital or to a lab or to dialysis. Or in our case, most of our non-emergency transfers came from Baylor Scott and White standalone emergency room to Baylor Scott and White Rowlett where they could be admitted. The hospital in Wiley, although they have a lot of capabilities in the ER, they don't have the ability to admit a patient. And so all of our non-emergency transfers, for the most part, came out of that facility to another local facility. But it doesn't really fit into our scope. We would be a pretty expensive transfer service.
It's not, I don't think that's something we have to worry about, because I don't know of any facilities that we would do transfers out of here.
No, unless, a big thing now, and I don't know that we've ever had any out here that I remember, but there are some home healthcare places now that will have 2 or 3, 4 patients in a regular residential home. We have several in Wiley. I don't know that I've ever heard of any in St. Paul that I know of. That would be the only thing outside of it. You don't have a facility that I know of.
I think over here on the corner of Parker, the proposition, one of the builders was going to put some type of.
Healthcare place.
Yes.
Is that in St. Paul or in Wiley?
Technically county.
County.
Yeah, it's probably county.
Because I know we have one up on the north side, just across from y'all city limits on the Monroe property.
Yeah.
A Ladera, but it's 55 and up, deed restricted, not so much healthcare side.
Oh, you're talking about the new construction that'll begin.
Yes, sir. At some point, I haven't seen the plan yet, but it was approved by our
Right.
council. But I didn't know if that's what y'all.
Yeah, no, so where I'm talking of is at Parker and 1378 on the, what is it, on the south side.
Okay.
South.
But yeah, that's county, so that shouldn't affect us. But basically, we need to probably keep our eye on that if we do end up having a facility that pops up. We may need to have some kind of agreement for transfers with private companies, plural.
And most of the time, those agreements are between the provider and the long-term care facility. Most of the time, the cities don't get involved in it unless you want to manage them operating in your city.
Okay.
It wasn't so much about control for us, it was more about, we didn't want these private ambulance companies coming in and not being able to handle the calls. Or what they do a lot of times is they'll send 1 or 2 people out there, especially if it's like somebody that they'll constantly need help loading.
Okay.
We wanted some ramifications that we could tell them, hey, y'all can't take those calls and continue to call fire department or fire department resources to help day in, day out. We don't mind helping occasionally, but they're making all the money. So that's what we were really trying to manage with that.
How many employees did Wiley end up hiring as a direct result of the
21.
21?
Yes, sir.
And how many ambulances did you guys acquire?
We have.
Ordered and acquired?
We have 5. We have 1 on order. We're fixing to order another one. And we bought 2 Plano ambulances that were end of life for them. Plano's gone to a model where they buy them all at once, and then they replace them all at once. And so they were cycling theirs out. We bought them from a local dealer, had them. So we basically went through them and everything that was wrong with them had fixed. They're 2016 models. They got just right around 100,000 miles. So they need to be cycled out. But they're very dependable. We've had good luck with them, and we've got 2 more on the way over the next, who knows, 18 to 36 months. So we tried to buy 2 chassis to get us ahead. They're going to be delivered in October, and so we're going to try to provide those to our manufacturers that will hopefully move us up on that list. That, hey, if you've got the chassis sitting there, can you go ahead and build ambulance? Because that's one thing that's still strong now.
And these are 21 FTEs, full-time employees
Yes.
versus non-contracted?
Yeah. Got 18 in operations and then some administrative positions. One thing we're doing probably a little unique to others. I mean, the system itself is a bit unique because they're not firefighter paramedics. They're EMTs and paramedics. A lot of them are firefighters, and a lot of them want to transfer over to the fire department, but they don't have to be a firefighter paramedic. So we've got a 19-year-old girl that graduated from Wiley High that went straight to EMT and paramedic school working for us, and we've got a guy that's been a paramedic for 37 years, and kind of everything in between. Those people wouldn't have had that opportunity to get hired by us had we done a more traditional model. I don't know where we'll end up in the future, but I think it served us well for now. We also hired an analyst for EMS that's going to review the charts before they go to the billing company, so that we can maximize the return that we get, and that should help to keep everybody's prices down. The more money, the kind of model is cost sharing, the more money we can generate, which this is not a money-making business, but the more money we can generate and help offset the expenses, the less we'll all pay.
I think you looked at the chart, you can see that if revenue, and that's year 1 revenue, and that's fairly conservative because we just don't know.
Right.
But as that revenue goes up, everybody's costs should go down. And so hopefully next year, you can easily see on the
Right.
chart that if we get revenues up, which is what Chief Blythe was speaking about with our data analyst, our records analyst, that her job is to make sure all the charts are done right to maximize revenue. That next year when we're sending you a new quote, hopefully it's coming out. The other thing that'll have an impact on is that the lawn continues to grow, and that percentage of call volume shifts that way. It drives yours down, both in fire protection costs and in, it's the same kind of the way it works. It drives it down for you all.
Right. Are you guys committing to any more long-term contractual agreements with any other municipality?
For emergency medical services? No, sir. No.
So it's just year to year?
That coalition existed previously. That's the model we're using now. Parker, St. Paul, Collin County, and our fire district in Lavon. And so we'll continue to do that. We have no interest in expanding that service. In fact, I think Levon's probably going to have to, we've met with I told you last time, we've met with their city manager multiple times, and their fire chief, to discuss long-term what's the plan. Because they're not going to keep wanting to wait 10, 11 minutes for an ambulance from Wiley, especially as their call volume continues to increase, and their growth is where we were in the early 2000s. And so I think whatever Levon's looks like, I think that will be the big change, whether we add an ambulance out there or whether they go a different route and do their own. Whatever, I think that will be the next big change. The only other thing I think I mentioned to y'all last time, in our 5-year plan, we have adding a 4th full-time ambulance to the system. And that's in year 5 of our 5-year plan. We're in year 1 right now with the current budget that we're working on.
Right, I guess to get to the final end point of it is, in the event that a municipality such as Levon decides to drop off of this interlocal agreement, does that increase the overall cost for St. Paul? It does.
It would, yeah. It would for all of us, yes.
Even if it's at 10%, right? So that 10% would be an equal shared cost amongst the municipalities.
Right. And I think from discussions with Levon, at least in the immediate future, next 3 or 4 years, they have no interest other than maybe to get an ambulance out there, but not go off on their own. It's an expensive, it's expensive.
Right.
And it takes a lot of resources, and they're still trying to build their fire department, build a lot of their infrastructure. I don't think they're ready to jump off into this unless they absolutely have to. Now, council may change and may say, hey, we want something different. But right now, I think that's the city manager's direction and the fire chief's direction.
Thank you.
On the collections, I have a question. So, from where I came from, they don't collect anything, right?
Mm-hmm.
So, who eats what the company can't recover? Do you guys,
We
part
all
of that
do.
contract? Because you know there's always going to be a little bit of that.
I mean, we all do. We learned a lot about this, obviously. We're trying to collect $519 per transport. They call it cash for transport. The old collection rate, the percentage of collection rate is kind of an old method that we all used to use. But the goal now is $519 per transport. That's cash that the city wants to collect, or our building company wants to collect. We hope that generates $1.25 million annually in collections, actual
Right.
cash in our account. To do that, we've got a bill somewhere in the ballpark of $9 million in billing, in gross billing to collect that. So the rest of that is just written off by the city.
Okay.
But it affects the whole system, right? Because if this is only $750,000 next year in collections, we're all going to have to pay our percentage of that increase. And so, again, we've already started on our guys about the reports, about certain things that the billing company needs. We've been meeting with that billing company, trying to find out, hey, what is it? Zip codes? Is it face sheets? What is it that you have to maximize? And then we've got a person dedicated to dealing with your residents and ours for billing needs, billing questions, and that is our primary job. Including making sure those face sheet, those reports are correct before we send them to Emergicon, who's our contracted billing company. So this, like Chief Ritter said, is a very conservative estimate, but we just don't know year one. A lot of this is new.
But you're going to review it yearly?
Every year,
Yeah.
yes.
Okay, fair enough.
Yeah, I hope it's double that year 1.
Right.
When you get in the business, you're a new vendor to the healthcare insurance company, so there's some holdups and things. Do we have this form? Do we have that? That's Emergicon's problem to solve. So we're kind of limited on the quality of patient care reporting and completeness and thoroughness to ensure that maximized billing. There's been several startup agencies in North Texas over the years. And most agencies that are established sit at the 30 to 40% collection range. And most agencies that start up without the additional systems that we implemented are collect 10%, 12% the first year. Because we've had such a head start. Beverly's in place. She's learned the system. She's a certified billing analyst, EMS record town, all this. She's doing all this stuff, and she's already started the process even though we're not billing today, of checking that. Honestly, I hope it's double what we collect next year, but when you're projecting revenues to the finance director in the city, I'd rather over-deliver.
We want to
Over-deliver and under, whatever it is, over-under, but I can't, there's no way in good faith I could, we're gonna make $3 million next year, and then come short, that's devastating. So they're very conservative. You have to be in year one because we just don't know what the insurance companies, I mean, they don't want to pay. So that's the game, and it's our billing company's job.
Okay.
They feel pretty comfortable at a little bit higher number, but we just didn't, using other agencies' data that they shared with us. They don't have the systems that we have, though. Their reports go straight from the paramedic to the billing company without any, and some cities are happy with. But due to the complexities of the system and servicing 4 cities and trying to maximize the business so that everybody can afford it and share it, we took that extra step in hiring that person to intermediate between us and the billing company. So hopefully we're sitting here smiling next year when I'm not much at all.
Just curious, what collection rate are you using for your year 2?
We're not there yet.
We're not, yeah, we're gonna wait and see how much we start out collecting now. We have to be very careful because obviously the city management council is very interested in revenue. And so they've given us some numbers, but we're very careful to share with them because those are the only numbers anybody remembers, right?
Yeah.
The maximum amount we were gonna collect.
What's the collection time though? I mean, so you bill somebody, what's the average?
You said 90 days?
90 days.
60 days.
So basically the last quarter of a fiscal year, you're not gonna get that till the first quarter of the next fiscal year.
We're worried about that, but they're not all 90 days. I mean, some of them may be short. Some of them we may have. One thing about it is our private vendor has been billing Medicare, Medicaid on our behalf currently. So now that's all being transferred to us. And so we're hoping that Medicare, Medicaid, although that's the lowest amount, that's only like $300 a transport. We're hoping, since that's already established, we'll start seeing those, funds from that pretty quick. And then, the other stuff I don't know that it'll be final quarter, but I think it'll start trickling in. And as the fiscal year goes on, I think it will begin to increase. So, and then one thing I just want to reiterate, we have a contract billing service, but your citizens would be billing with their bills, everything on there will take them to Beverly, who works directly in our office. We didn't want, she's going to be doing some surveys and stuff to include St. Paul residents. So we didn't want, we wanted that to be the face of our organization, not a contracted billing company. So although they're very helpful, and I think they're a great company, they'll be contacting her and your system. Hopefully none of that, we've had some billing issues with our current provider, especially over the last 8-9 months. Hopefully none of that's made it to y'all up here at City Hall. But we've been working through those, and Beverly most recently has been working through them. And so I think that will be better for all of us. Not that Emergicon is not quite capable and don't do a good job, but somebody local that works for us, I think, is going to be more attentive to our citizens' needs, all of our citizens' needs, versus a contracted company. So.
Robert, JT? No? Justin? Larry? Okay, good. Okay. So you have interlocal cooperation agreement before you. Do I have a motion to accept this agreement?
And the final agreement was approved by the attorney.
Yes, that's correct. The corrections were made.
I'll make a motion that we approve it.
Okay. Do I have a second?
Second.
Okay. All in favor?
Aye.
Who's nays?
Did you second it?
Yes, Larry did. So motion is passed. Thank you, gentlemen, very, very much.
Thank you.
Do appreciate your time.
Yes, sir. Good night.
All right, thank you. So 5-2, discussion of possible action on a resolution which includes accepting the proposed property tax rate, establishing the date, time, and location of the public hearing on proposed property tax rate, setting the date, and adopting the property tax rate. and providing for publication of the public hearing. Do we have any discussion on this? You see the resolution before you, Resolution A. We had our workshop on Thursday of last week. You can see that in Section 2, that property tax rate is at .224604, which is what we discussed last Thursday. Nothing has changed since then, correct?
No, sir, it's all the same. We do have to take a roll call vote on this
Okay.
resolution tonight, so when
Okay.
you're ready.
Whenever, is there any more discussion that needs to be had?
The only one that wasn't here was David.
Yeah, makes sense.
Okay, so since we're taking a roll call vote on this, so the mayor, David Dryden,
Do we have a motion?
the motion is
Yeah.
to accept.
Well, I mean, so I'm trying to follow what you prepared.
Right,
so I
right.
think that's really wise.
Right,
I
yes,
The
sir.
new format,
I
guys.
appreciate the effort that you put into that, and the motions, I think, will help us keep things straight, and it'll keep us where the record's straight. So I really encourage everybody to use that. I don't mind reading this if you'd like for me to motion.
No, let's go ahead.
Okay, I move that we approve resolution number 24-08-12-A, accepting proposed tax rate of .224604 per $100 evaluation. No, that's not in there, but I'm going to say that audibly, which is the no new revenue rate, and establishing a date, time, and location for the public hearing on the tax record, providing for date to adopt tax rate, and in addition, providing for the publication of the public hearing
Be on September 9th.
to be on September 9th.
I'll second that motion.
Okay, so on a roll call vote, David Dryden,
Approve.
okay, Larry Nail,
Aye.
Justin Graham,
Aye.
JT Trevino,
Aye.
Robert Simmons,
Aye.
okay, and me as an aye as well. So adoption of that resolution 240812A was passed. So moving on to the next one, the discussion of possible action on resolution number 240812B, which includes establishing the date, time, and location for public hearing on the proposed fiscal year 24-25 budget, setting a date for vote to adopt the budget and providing the publication of the public hearing. And that's on September 9th.
Yes, sir.
Okay, so,
We did make a few changes to the proposed budget from the last workshop based upon our discussions. We increased the TMRS and SEP by about $8,000. We removed the revenue of $1,000 for the Collin Park sign, and it increased our budget roughly about $950,000 versus what was presented to you last week.
The 150, where did that come from?
The $950,000 is a proposed new budget.
Okay.
So we increased the TMRS and SEP by a little bit over 8,000.
Yep, and then the 1,000.
And then we
removed
removed the
from
1,000
council.
from the revenue side as well.
and that changed the numbers by,
We were at, look here, originally, we're at $941,863 last week, and now we're at $950,606. We increased on the revenue side interest. So I think we were somewhere around 93, 98,000 last week, and we're up to 103.
And we already felt that was
Right.
fairly conservative.
Exactly.
And going up on the TMRS account is from 6 or 7 or 8, going to 8%. Is that to
Well, we increased it a little bit over $8,000. So last week, when we actually had our work session, I had received an actuary study
Right.
from TMRS, so I didn't have that number in the
And now
budget
you
at the
do.
time.
Yeah.
And so I explained to council last week that we'd have to adjust it, and that's exactly what I've done.
So they shared that study with you? Is that study something that we can view at some point?
Absolutely.
Discussion?
Just read.
Any? So the motion is going to be, I move to approve the resolution on 240812B establishing the date, time, and location for the public hearing on proposed fiscal year 24-25 budget, setting the date for a vote on adopting the budget and providing for the publication of the public hearing notice. You can see your resolution attached to include. So this will be another, I take it, roll call vote.
No.
Not?
No.
Also motion.
You what?
Also motion,
I'll second.
repeating what you.
Okay. All in favor?
Aye.
Motion passes.
Was there a second?
Friday.
And I wasn't familiar with this one. 5.4, discussion on social media policy. Is this yours, Justin?
I think I asked for it to be added. Because I know that we're going to be starting engaging more, so I thought we should talk about it and just figure out what do we want in such a policy, because I think we're reclaiming any pages that are out there, any kind of automatically generated social media pages for the town of St. Paul, and in that we'll take ownership of them. So, there's different options that we might consider, like, for example, we probably would not want other people posting to the page without it being approved by, because you can select that, like on Facebook or other types of platforms, where the town has to approve anything that's posted. I don't know that we would want to keep people from being able to post at all, but we certainly would want to review it before it's put on the page, that kind of thing. Do we want to allow for comments, and if you do, it's the whole world.
That's right.
And so it could be anybody, anywhere in the world could post anything they want to in the comments, and we probably don't want to do that, but I'm open to discussing that.
Do you know of other towns that have policies that we can
They vary, but I have
review
worked.
and use?
I mean, they're easy to come by. We come up with 3 or 4 different samples for council to look at. But I have worked with the community, exactly what you have just explained, where, we weren't monitoring Facebook very well, and we let comments on there, and it was a free-for-all. So I would agree with Robert that there needs to be some sort of controls in place, because it could get out of hand.
Yeah, the problem with, because full disclosure, I run a Facebook page for Save Lake Levon whenever they're trying to put the 8-lane bridge over the heart of the lake. That, along with another website that I run for that effort. It was over a 10-year period. It's really not active anymore, but I still keep it up just because, you never know when they're going to try to do that again. And me and a couple of other administrators on that Facebook page make sure that we watch everything that's on there. Because you get all kinds of advertisements, you get weird stuff. I mean, I don't even want to talk about some of the weird stuff you get on here. Most of it's just advertisements, and that's not what it was there for, and I don't want to have that. But I do want to have interaction from the public, so we do take the effort to go through. It's me and 2 other people that go and look to see if it's acceptable or not. But it does take manpower to do it. So I think that probably we'd want to look at some policies that allow for folks to post, I guess, if we have the bandwidth. It really comes down to, do we have the bandwidth? Because if you start being judicious about comments, now you're censoring certain things and not others. So it may be best to have a policy where we just don't allow for any posts except for our posts, and we don't allow for any comments except for comments that we put on there.
At least
because otherwise you're going to get into all kinds of, well, you didn't let mine go through, you let somebody else's go through, and it's,
Freedom of speech.
No, we have a citizen comments portion where it's supposed to be discussing agenda items that are active.
Right.
You could almost do the same thing with citizen comments portion regarding anything that they saw from the previous month's meeting minutes. Because if we're gonna put this on the website, which I'm in favor of, so the public can see, we could address it at each meeting, just from the last meeting, not go back 6 months, not go back a year, but address just what they've actually seen and ask questions related to. I don't think you'd see that happen very often. Justin could probably tell us out of 1,000 people, how many people are watching. It's bigger than we thought it was gonna be, but it's probably not over, what, 125 people?
Yeah, I'd say probably, I think they average about 30, maybe to 50 views per meeting. Depends on the meeting, but yeah.
And again, if we get it out there from our website, that number's gonna increase, but it's still gonna be a 10%, 15% at best, that watch it continually. And so we might be able to just address that through the monthly meeting. And
Address
just do the
questions
citizen.
or comments that come
Well, the
up.
citizen comments allow not only agenda items, but anything
Right.
from the prior meeting that they caught off of
Probably what
video.
we should do, I would recommend that we put in policy that we have, make sure that the emails are very readily available for the town and for any of us, like, you know, direct them to our website and encourage them that if you have questions about this video, or if you have questions about this Facebook post or Snapchat or whatever we're using, that they email us, and then we address it through email, because we're already monitoring our email system, and we should be able to answer it there. And that way we're not getting into the,
Plus, it gives us a train of custody to see what's going on and all that stuff.
You can always enable them later, right? I think a good default would be no comments at first and then
Exactly.
figure out how that
Start
works out.
very
Open it up.
basic.
Yeah.
but still encourage them to contact either through phone or email.
Mhm.
You know, because we can answer the phones too, and talk about anything that they've seen or concerns they have. We do want, I mean, we certainly want to have interaction, it's just we've got to be careful about
Well, the
how
other
it
thing-
can be misused.
Yeah, if you want to start addressing comment, and I know that would probably be a second or third phase, everything has to be listed on the agenda, because keep in mind, it's an open meeting, and you just can't provide general comments about
Anything,
anything.
right.
So if we're going to start addressing comments from any of our social media, they'd all have to be listed.
Well, and the only thing is I wasn't considering this, yes, once you put it on Substack or whatever it might be, it's social media, but at the same time, it's, I don't necessarily call it open social media if we didn't allow comments on that just to be addressed here. Because that way they had to be in this building in order to make it a public comment. So we could control it, you're right, none at first, but then open it up a little bit. And I think it can be controlled.
I would say, what is the purpose of us even having any kind of social media platform? To disseminate information that town residents might need, right?
Exactly.
That's it.
That's it.
Information to them.
Then any kind of comments, I think, are dangerous.
Yeah.
Okay.
I mean, if we're wanting to send information that's important to town, sure. But people criticizing each other's political beliefs or religious beliefs. or-
Well, even, I hate to interrupt, but if you don't mind, I'll use this word, because I was thinking, how do I mention this? What it can also get, which is really the worst part, is it can get perverse, and it's really.
Sure.
Yeah, I've seen some awful things,
So, I
so.
mean, if it's our tool to
send
out information that's critical to the town, then yes, but I would say I would not allow for any kind of interaction, comments.
Okay.
I agree.
Okay.
And we don't have the manpower to.
Right.
I was just gonna
That's
say,
it.
Yeah.
If we had manpower, maybe you could, because you got to be on there like a hawk.
You got, especially with multiple platforms.
Right.
Now all of a sudden we've got a city staff person doing this hours
Full-time.
a day.
So what I'll do is I'll prepare 2 or 3 draft policies, and you want me to work with Robert? and
Sure.
Another council member initially?
Yeah, that's, if you can bring
Okay.
2, I'm always big on 2, but
Okay,
And JT?
right, okay.
Is that okay, with everybody? So, yeah, and I will say this too, is there's 2 different, when the internet first came out, being in the industry I'm in, they would encourage us not to have pages, just don't even do it. Well, the problem is somebody come claim my name and then go represent themselves as me. So I do think it makes some sense for the town to go ahead and claim these pages that are often are auto-generated by either Google Maps or by Facebook. And so it's probably wise for us to go ahead and claim them, and so that nobody else somehow claims them and starts representing as the town.
okay. Is that something you can put together for them?
Yes, I
Okay, we can do that. And then is, any other input on this? Y'all okay? Y'all want to be a part?
I can if you need help.
Okay. If you need another one, Larry Nell down here can help you out as well. If you want to run through any of them, so. Okay, you all good with that? For a start, the beginning?
Yeah.
So for the public that doesn't know, if you look up above your head, you'll see a camera up there now. So it is now in the control of the city, the town, so the town records all council meetings for record retention. We'll be saving those indefinitely, and so that we have a record of everything that happens here at these meetings, help Scott out with the meeting minutes, everything is a little faster, a little easier, and it'll be clear. Eventually, these will be put on our website, I don't think they are yet, but they'll be on our website for you to hit a link, be able to go to these. If you miss a meeting, you'll be able to pick it up and look and see exactly what your town's doing for you. And so that's just for you guys that are out there. So I guess at this time we move on to agenda item 6, the executive session. As authorized by section 551.074 of the Texas Government Code, the regular meeting will convene into a closed session regarding some personal matters, personnel matters, city attorney and special counsel. So at this time we'll go to executive session. All right, so August 12th, coming out of executive session from the council meeting, no action will be taken on discussions from executive session. So item 9, council discussion with staff concerning any actions required by town staff for this evening's agenda items or future agenda items. So this would be, Scott, what is it that you're asking?
If there's anything specifically you want on future agendas, or if there's any actions I need to be taking, this is your time to give council or staff direction if there's something particular that you want to start preparing for upcoming agendas. And I think we've talked about that in great detail. So
There's some items tonight, I think it's mainly around the, I think it was the fee.
the fee schedule.
Fee schedule and updating that to be dynamic with BV, right?
Right, exactly.
I don't remember anything else. But,
Okay.
and of course, we can also email you.
Right, exactly. This is just an opportunity if there's something you want to present that you'd like for staff to have on future agendas, and you direct us.
I mean, the only thing that I know of that the council's mentioned in the past, there were some items I asked Justin to put together something, agenda items that were either passed or discussed that died, that just disappeared. So if anybody can think of anything over the last 12 months that you really thought of, that you wanted to finish, bring it up. And let's
There's a lot.
discuss it.
I mean,
I understand that.
Where's your notepad?
No, not the 60 items JT never got to go.
Well, I think
67.
I think we've already maybe mentioned in previous meetings, or maybe this one, about KSA and getting with them and having, I would really like to have LBL or KSA, whoever they're representing, come talk to us about what they got for roads and drainage.
What plan was it?
Yeah, there were some kind of plan, they call it a comprehensive plan, anyway, some kind of plan, road plan, basically a 5-year road plan, because there was an older one that we've already done a lot of work on, probably, OBE, as we say in my industry, it's not really relevant anymore, but that, something like that needs to come from KSA. We'd asked them last year, or earlier this year, to update or produce a new 1 to 5 year plan.
Okay.
And
Go ahead.
at one point, a previous agenda item was P&Z training.
Yes.
And getting a kind of a higher education for P&Z on procedures and things. Is that?
Yeah, Gary came by today, and I spent about an hour with Gary, P&Z chair, and he brought that up. So I told him probably in September, no later than October, we'll put something together for P&Z training.
Well, hopefully TML may have something that we can use.
Relatively easy.
Or even a class that you go attend.
Because I had spoken with Gary also about,
So we have new members.
we have to be sworn in, but we also spoke briefly about the development plat process, the minor plat process, and how we need to move that relatively quickly. So he's on board with that too. I told him more likely that would happen in September. So.
Thank you.
Kevin to know if all the, what members, or all the current city members have active emails at this time?
They should.
Email them and ask.
Bob London,
Seriously, email them.
yeah, I gave them all to Gary. He has them all. I've asked him to reach out to them. Bob London's got, when I set up yours, Larry, I actually went through IT to set yours and Bob London's up. And for some reason, Bob London's fell off the radar, never got done. So I just got it done last week with IT. So I asked Gary, I asked IT to call Bob, make sure it's working, and then I asked Gary to email Bob to make sure that he's active on that. So that all the P and Z members should be up and running at this point. I haven't heard any to the opposite of that.
So are you posting those on the website?
They're supposed to be posted on the website. I don't know if Alex is in charge of our website now. She can easily change those, post those. So we can. JT brought up something earlier about the reservists. I don't know how many reservists we actually have for P and Z. Gary didn't give me a number.
Alternates?
Yeah, the alternates. So do we want emails for those particular people as well to keep them up to speed for training, for
Yes.
those kind of things?
Yes.
If we do, then I'll find that number and get that done.
You just had, I don't think it calls for, I think that's more of an administrative
It is.
decision. But
I'm just kind of taking opinions.
Yeah.
Yeah, okay.
So what we'll do, yeah, let's figure it out.
Yeah.
You'll put all the P and Z members' emails on there. Alternates will be part of a group email chain that, you know, since looking out about P and Z, they get the same information.
I would actually say no. I mean,
Yeah.
alternates need to be able to receive information
Right.
individually,
Sure.
not in a shared. are you
With the
on
whole
a
P and Z
email group?
commission. So if just like I have mayor and council.
But you, so you're not saying that they wouldn't have their own email, you're just saying you'd put them in a group?
Right.
Oh,
So they're still gonna have their own individual.
Okay,
email.
okay.
Right, I'm
So
sorry,
they're
yeah.
still gonna be able to individually receive.
Oh,
it.
yeah, they'll all be in the P and Z.
Yeah, I'm sorry, yeah.
that works.
Okay,
Okay.
so that's 3 items for a start.
Good enough?
Nice job.
Yeah, thank you.
Yeah,
Yes,
thank you. Thank you for everything, the progress that, you know, I feel very confident
We'll get
where
there.
we're going.
Just trying to get our feet on the ground, figure out how y'all operate.
Yeah. Well, thanks to the mayor and the new members too, appreciate all your help and digging in and learning and moving forward.
Butt kissing now. After the comment, so.
Maybe that crab sandwich.
Yeah.
A little good.
Exactly. So, any other discussion points y'all like to bring up to Scott? Larry, any more for Scott? Okay, do I have a motion to adjourn?
Motion to adjourn.
Okay, do I have a second?
I'll second that motion.
All in favor?
Aye.
Motion passed. Thanks,